Picture the person on your team you'd least want to lose. Not your newest hire, the one who's been there 8 years, knows why you do things the way you do, trains everybody else, customers ask for them by name, and then one afternoon that person is sitting across from you telling you they're taking another offer. The other company offers health insurance and you don't. That's not a random employee leaving. That's statistically the person on your payroll most likely to leave over benefits and the one you can least afford to replace. I'm Phil Hamblin with Life, Health, and Peace of Mind. I've spent over a decade helping small business owners make sense of health insurance, and my goal is to make you expert enough to make sound decisions that bring you and your company peace of mind. If you have under 50 full-time equivalent employees, you're not required by law to offer coverage, so none of this is about anything that's mandatory. It's about what's smart, which of course is your call. Which leaves a real question: why spend the money when the law doesn't make you? The usual answer is turnover, but not all turnover costs are the same. Somebody works for you for 4 months, moves on, you backfill the role. That stings for a week. The turnover that actually hurts is one specific person, the one with real tenure. Not just experience in your industry, experience in your company. They know which customer is particular about what. They know the workaround for the thing that's been broken for 3 years. They're the reason your new hires come up to speed at all, whether or not that's written in anyone's job description. When that person leaves you, you don't lose a role. You lose a piece of how the business works. And you can't simply just hire that back. I mean, you could post a job, pay market rate, find someone genuinely talented, and still not recover the 8 years of context that walked out the door. That part never shows up on a spreadsheet. You feel it in missed details and slower answers for about a year, sometimes longer. Two facts rarely get put side by side. The employee you can least afford to lose is statistically the employee who cares the most about health coverage. The Employee Benefit Research Institute, or EBRI, asked workers which benefits they value most. Setting pay aside, among workers 50 to 64, quality health coverage came out on top at 42%. The Employee Benefit Research Institute, or EBRI, asked workers which benefits they value most. Setting pay aside, among workers 50 to 64, quality health coverage came out on top at 42%. Among workers 21 to 34, 25%. The younger group picked career advancement instead. That gap is wide enough that EBRI flags it as statistically significant. That describes someone specific on your team. The 50-something with tenure is usually the same person carrying a family on their plan, or managing a real condition, or helping a parent who's declining. Coverage isn't an abstract perk to them. It's what stands between their family and a 5-figure bill. So the person whose institutional knowledge you'd missed most is the same person for whom his decision weighs heaviest. That's not one survey either. The Society for Human Resource Management found that 92% of employees say health benefits matter to their job satisfaction. 56% say the quality of that coverage is a major factor in whether they stay. More than half your team is weighing your benefits quietly, whether they ever bring it up or not. That's decades of economics behind it too, going back well before the Affordable Care Act or the ACA. Economists call it job lock. Workers with employer coverage change jobs less often than similar workers without it, across a whole set of independent studies. In other words, coverage makes people stay put longer. Some of that research found employees on an employer plans are less likely to retire early before they qualify for Medicare at 65, specifically because leaving means losing the coverage, which puts the effect exactly where the EBRI numbers point. You're older, longer tenured people. Here's the fair pushback on the job lock, and it's worth taking seriously. A lot of that research predates the ACA, when leaving a job can mean losing insurability altogether. A pre-existing condition could make you uninsurable on your own, but that's not that world anymore. Someone who leaves you today can go buy a marketplace plan. That option looks a lot better on paper, though, than it works out in practice. A marketplace plan usually has a narrower doctor network than a small group plan can offer, and a different formulary, and that's the list of prescriptions the plan actually covers and what you pay for each one. So somebody who leaves you can absolutely get insured. Whether they can keep the same doctor and the same medications at the same cost is a completely different question, and a lot of the time the answer is no. What that means for them is paying extra out of their own pocket to get back what your plan was already giving them, which is exactly why coverage still weighs on the decision to leave. Not because they can't get insured without you, because getting the same care costs them more once they do. A 2025 EBRI report backs the practical side. Roughly 3 out of 4 employers say their benefits improved recruiting, retention, and performance. About 70% said it improved employee health. The Kaiser Family Foundation found employers covered an average of 75% of the premium in 2025. That's real money landing in your team's pocket every month, not an abstract perk. So none of this is what stops most owners. The most common reasons owners tell me no isn't that they don't see the value. Most of them do. It's the premium. They look at the number, compare it to what the month can absorb, and decide it doesn't fit. And that's fair. But the number is usually a guess. And this guess is usually in the form of a fully insured quote, which is the most expensive option there is. They don't know that there are other options out there that are probably available. If an employer wants to get their people covered, there's almost always a way to do it. The version you priced 2 years ago probably wasn't the whole menu. So that's why instead of guessing, I put together a free 2-minute benefit scorecard. You answer a handful of plain business questions, no health information, nothing you have to look up, and it shows you where you stand and the simplest place to start for a team of your size. The link is in the description below. So here's what it looks like when it works. A woman who worked at a title company came to me, and her husband had been diagnosed with cancer, and he needed a plan with MD Anderson in the network. At the time, MD Anderson wasn't on any marketplace network, and the best plan she could find was outrageously expensive. So we explored employer group plans with her employer. In Texas, that opens up PPO networks the individual marketplace doesn't reach. So I wrote that title company a group plan. She got coverage that included MD Anderson, and she saved somewhere between $700 and $800 a month. I don't know what would have happened otherwise. But what I do know is that an employer had an employee going through the worst year of her life. And because that employer offered a group plan, the answer to, can we get my husband to MD Anderson, was yes, instead of a no. What is that worth in terms of someone's loyalty to you? It's something to think about. Group coverage opens doors that often aren't available to someone shopping alone. Things like doctor networks, specialists, plan designs, and drug formulas. It's a big deal. When someone on your team gets sick or has a baby or has a parent that needs surgery, coverage means a health crisis doesn't also become a financial one. It's also the kind of thing that makes a good employee let a recruiter's call go to voicemail. So in all this, I'm suggesting that health insurance coverage might mean more to your people than you realize. Remember that 42%, your most experienced people, ranked quality health coverage as their most valued benefit of all. And usually there's a way to get it done. That's why I'm trying to help you figure that out. So perhaps instead of saying, should I do this, we can figure out the smartest way to get it done. Remember that benefit scorecard I mentioned earlier? The link is in the description below, or you can just call me at 817-778-8004. Here's to your business and your peace of mind.